Good morning. My apologies, I could not be present today at the occasion of E.O.P.H.I 10 years anniversary. In the next few minutes, I'll try to share a few thoughts around the access to innovative treatments. I believe it's a common interest between the government, the population, and the pharma industry that all eligible population has access to the right drug at the right time. And I know, and we know, that this has been the primary objective of everyone at E.O.P.H.I today. But today we live in the era where the therapeutic evolution is taking place, which provides substantial health benefits to population with high unmet need, which would have developed serious diseases without existing treatments. Just think about rare diseases or oncology treatments. But providing access to those innovative medication has a big benefit to the society. People live longer, have a better quality of lives, work, and produce more, so we have an increase in the economy in the country. Certainly, for a payer, this influx of a new innovation may create a financial discussions in the sense of whether the organization can afford the additional costs associated with those therapies. And here Greece is not alone. Traditionally, the healthcare system, though, have managed to cope with the new innovations in a very productive way in case of HIV, HCV, or oncology expensive treatments, which did not eventually risk the sustainability of the healthcare systems. Of course, there is a short-term increase in the pharmaceutical cost. However, in the majority of the cases, we had a big savings in other parts of healthcare system. For example, thanks to new oncology treatments and the early detection, overall survival had significantly improved. While at the same time, hospitalization and other healthcare treatment costs have been significantly reduced, because with the new treatments, we have effective way to keep patients out of the hospitals. But pharmaceutical care also works in the mechanism of automatic distribution of financial resources, from therapies which lose patent to new innovations which are still patent protected. So a large part of those costs of new innovations can be offset by savings in the other non-innovative part of pharmaceutical care. And that is happening on all over the world. Another measure that is taken to protect financial sustainability of national payers is negotiating the price of new drugs. This is a very reasonable expectation because we try to have the right prices that represent the value of the products and the right number of targeted patients. So we are very happy to engage with the negotiations with the negotiation committee as a part of the national HTA process. We also understand that if we come prepared with the appropriate evidence, we can negotiate a sustainable agreement for all parties. And indeed, in oncology field, we had some very good examples of that. I also want to recognize that the number of initiatives taken by E.O.P.H.I in the recent years, like SAP, like the effective communication, has secured that many Greek patients have access to the broad range of innovative medicine. Though I have to say that focusing only on the price and not on the relative price of the product is not the best approach, as national payers usually should seek to reimburse the product with the high clinical value, so to maximize the health benefit for the population. And overall, we should recognize this value and not evaluate all the products under price criteria only. Although negotiations has been a very, very useful tool in the past years, and the negotiation committee has accelerated the pace of negotiation significantly, but for the future that is not really enough. We must focus on producing the right data which could prove the value of the products and the effectiveness of our negotiation agreements, and that would lead to more efficient negotiations in the future. In addition, though, we need the implementation of the other structural reforms in the Greek system, like disease registry, patient record, prescription protocols, and provision of incentives for economic behavior to the entire of the pharmaceutical distribution chain. We need to rationalize pharma spending in terms of reducing overall consumption, but also increasing budget so that we will ensure the seamless access to the new innovations. The current level of austerities will not allow the seamless access of the new therapies, and this is the risk of the population covered by E.O.P.H. As in the industry, we have been working and we will continue to work with E.O.P.H. to ensure the best possible outcome for the population. I really, at the end, thank you for the sincere and the positive collaboration so far.